Welcome everyone to the Grand Forks Virtual News Conference, Thursday, May 14th, 2020. Today we'll have a report from Director Swanson from the Grand Forks Public Health. We'll visit with Dr. Steve Gander, Mayor of East Grand Forks, and Dr. Terry Brenner, Superintendent of Grand Forks Public Schools, and Jeff Gockler, the Mental Health Coordinator for the community. Thank you for joining us and staying informed. A mass COVID-19 testing event took place at the Alara Center parking lot today from 10 to 2. This event initially was open for close contacts of those who have tested positive for COVID-19, essential workers and first responders. At 12:15 today, the event opened up to all community members over the age of 12. We should have test results in the lab early next week, and I thank you to all our local and state partners for coordinating this event. I'm going to send it over to our Director of Public Health, Debbie Swanson. Debbie?
Thank you, Mayor Brown, and welcome to the members of the media and the public watching today. Yes, we did just wrap up our testing event at the Alara Center, and we tested 473 individuals. As Mayor Brown mentioned, we had a target audience initially, but it appeared that we were able to accommodate more individuals, so did open it up. Oftentimes, these events are fairly fluid based on the resources that we have available to us. So we ask the public's patience and understanding when things change throughout the day. We would like to thank our partners at the North Dakota Department of Health, the North Dakota Army National Guard, and many other individuals that helped us, the Salvation Army, the police and fire departments from the city of Grand Forks, and my colleagues at Grand Forks Public Health Department. It was another successful event. And as Mayor Brown mentioned, we hope that all individuals will receive their results by early next week and know their status. I'd also like to express my thanks to the communities of both Grand Forks and East Grand Forks represented today, for all that you have done the past several weeks that have really helped to keep our community safe and healthy. We really do believe it has made a difference, and we ask for your patience and understanding in the weeks ahead as we slowly return to some of our activities that we'll be able to do safely. Keep in mind, our advice has not changed. We still ask you to cover your face, wash your hands, keep 6 feet apart from one another, spend as much time at home and with your family as you can, and that will greatly help us to reduce the incidence of disease from COVID-19. Thank you, Mayor Brown, and I will release the rest of my time for questions at the end.
Thank you, Debbie. So I want to say thank you to the residents of Grand Forks and business owners for taking the health and safety of our community seriously and for doing your part for a GF Smart Restart. Opening is voluntary, not mandatory, so please make sure you're able to run your business in a safe manner by following the guidelines and standards from the state of North Dakota. Consumer confidence is the key. The market will drive success. We need to focus on remaining smart and safe, even with the opening of high contact businesses. We need to be respectful of others and their safety while in public settings, at the store, and supporting local businesses. Abide by the physical distancing standards and help slow the spread. If we continue to focus on being smart and safe, we will have a successful GF Smart Restart in Grand Forks. My Economic Recovery Advisory Group continues to work tirelessly and provide insights on best practices and strategy moving forward. We actually just met and spoke about how recovery efforts from around the country will need to be locally led, locally executed, and locally supported. We in Grand Forks have been proactive and are taking the lead with our recovery efforts. We're working with a variety of industry representatives and are getting a diverse array of feedback and perspectives. This will be an ongoing effort, and the ability to remain flexible and adaptable will be key to adjusting to changing circumstances. Altru Health System is not on today, but a reminder that they're open for service and they have seen an uptick in regular procedures and preventive care. Remember, you can call their hotline at 701-780-6358, 701-780-6358. If you're experiencing a fever, cough, or shortness of breath and have had close exposure to a person with confirmed COVID-19. We're excited to have another Dr. Mayor on the panel today, Dr. Mayor Steve Gander from our neighbors across the river in East Grand Forks. Minnesota Governor Walz released further guidance for the state of Minnesota yesterday regarding business closures, and Mayor Gander will communicate what that means for East Grand Forks. Working together as businesses in our region open up with new standards and guidelines will be critical. East Grand Forks has been a great partner over the years. It's always been a pleasure to work with Mayor Gander, and I look forward to continuing working together. It's graduation season and a time for celebration for many students and families across the Grand Forks community. With a new normal we find ourselves in, graduations will look a little different, We are glad to have Dr. Brenner from the school district on to talk about that and other school district matters. May is Mental Health Awareness Month. It is critical to pay attention to your mental health, especially during these times of physical distancing, which is why we're happy to have Jeff Gockler from the Mental Health Matters Community Coalition on the panel today to discuss ways to exercise your mental health and the community resources that are available. And now we'll meet with Dr. Steve Gander, East Grand Forks. Welcome, Mayor.
Thanks, Mayor Brown. Very, very happy to be with you. Thank you for the invitation to join you today. Can everybody hear me okay? Perfect. Before we get right into the specifics of COVID-19 preparation, I would like to say publicly how much I appreciate the coordination that's taken place between our two cities all through the years. There's an old saying that you can't shut down only one end of a bridge, and it's true, because nobody will cross if you just shut down one end. Well, when we needed bridge closures for the flood fight, the communication back and forth was seamless, just like always. And also looking at bridge maintenance, we're about to enter into a sensible 50-50 sharing of cost for the inspection of the Point Bridge, which again is used about 50-50 by the two cities. And I'm happy to see common sense prevail even inside of government. So even now, to how do we serve our residents through public works and other city services, we're working hard to coordinate between the two cities. And we're working to make sure that our businesses are treated fairly at the local, state, and federal levels as we come alongside them in this recovery from this economic challenge. I would like to also give some recognition to an individual, Barry Wilford. He's worked so closely again with both sides, with our businesses. He's kind of even helped a lot inside of our city. You know, Barry and Paul Gordy, our economic development director, have had a great relationship. And so dovetailing into Barry's expertise and coming over to Paul and what he's able to do, this partnership has been so good. And I'm sure Barry's been as effective and helpful to you all in Grand Forks. But I do want to give him a shout out because, you know, he's been so good, even in communicating with Governor Walz. And, you know, to consider the position that our governors are in, I know, Mayor Brown, you feel the same way. I feel this way. You know, early on, President Trump made the comment, you know, when this COVID thing broke, it was the hardest thing that he's ever done in his whole life. This idea of how do I help this country navigate through this whole thing on the national level. And I'm sure Governor Walz, Governor Burgum feel the exact same way. You know, we all have the message resonating in our minds, you know, not on my watch. If this thing is going to go sideways, it's not going to be on my watch. But I think now, just now, slowly we're transitioning away from the government having to be quite so heavily involved and now transitioning toward just what you said also, Mayor Brown, and that is, let's each one of us take care of ourselves as we take care of other people. Let's take some personal responsibility. Let's probably wear the masks out in public. Let's do the frequent hand washing frequently touched surfaces. This is the time now. You know, last weekend, I can't deny, I was up at Lake of the Woods fishing. And what you say, what does this have to do with COVID? Well, I'll get there. Sometimes my stories go round about up at Lake of the Woods. And, you know, nobody likes to be told what to do. Nobody wanted to be told, you can't go fishing, you can't go golfing, you can't go this. Nobody likes that. But what about this? When it came time to go, there have always been about 12 of us on this fishing trip. But one by one, I called them now that we could technically go up there and go fishing and stay. But it would have been too many probably in one place. But one by one, each of the parties said, no, thanks, we're going to sit this year out. And it was just my two sons and I committed to go. This is where we're all headed. And I, again, my hat is off to the people now making these decisions because that is how we're going to really keep the lid on this. When we get our freedom back and not have to lose our freedom again, we keep a lid on it by each of us behaving responsibly. You're absolutely right when you talk about Governor Walz and some of the recent executive orders. As you indicated, even in Minnesota now, we can resume doing routine healthcare kind of visits. So your family physician, optometrists, dentists, chiropractors are back active as of this past Monday. According to Governor Walz's executive order recently, now more retail will open up at a 50% capacity. And as you know, the stay-at-home order is lifted, but groups of no more than 10 family and friends. And then the next stage will be at about June 1 to reopen more toward restaurants and other kinds of establishments where people gather, again, with limited capacity. So I'm so excited that life is coming back to normal. We can get back to the things that we enjoy. And once again, thank you to inviting me and helping me be part of this.
Thank you, Mayor Gander. Now we'll hear from Dr. Terry Brenner, Superintendent of Grand Forks Public Schools. Welcome, Doctor.
Welcome to everybody, and thank you, Mayor Brown, for having me on the panel today. Appreciate it very much. Terry Brenner, Superintendent, Grand Forks Public School Districts. We continue with our distance learning model. We are several weeks into this, and I think fatigue is setting in for not only students, but for some of our teachers, and certainly our parents are fatigued in the new role that they're playing as a surrogate teacher in their own household. But as always, I extend my gratitude to our teachers and our parents for making this environment work as best as it can, given the parameters that we have. So the last week of new learning will be next week, and we'll use our final week of the school year for a couple of different things. One would be for student catch-up, and making sure we don't have any students fall between the cracks, making sure we get those final assignments in. It's also going to be a time where teachers and some other staff will be able to, in a staggered manner, get back into their buildings to clean out classrooms, to prepare those for summer maintenance. And it's also going to allow us time for our technology devices to be returned to the building. So all of that's going to be communicated with our parents over the next few days. So parents, you can be looking for that. And we will follow all CDC guidelines when we do have our staff back in the buildings. And again, that will be in a staggered format. So it'll take a few days for teachers to clean out their classrooms. Just yesterday on our call, State Superintendent Kirsten Baszler, in our call, when I say in our call, she visits with superintendents across the state of North Dakota each Wednesday. She intimated that the face-to-face summer school opportunity with CDC guidance might be a dress rehearsal for what schools look like in the fall. So as Mayor Gander was talking about us getting back to normal, the new normal for us could be a different school start. And our district leadership team and principals were already anticipating that. And we're looking at multiple scenarios that include the three following items with a lot of nuance, differences, and details within each one. Number one would be business as usual with CDC guidance, although we'll probably have students wearing face masks, teachers doing the same thing, and probably shields for our adults as well. The second scenario that we could employ would be a morning session for student group A and an afternoon session for student group B, with some other variations of this model, with distance learning as a possibility as filling the other half of the day. But we want to be really careful that we're not overstretching our teachers and asking them to work 24 hours a day, 7 days a week. And the third option could be a very soft opening where we would look at our students with significant challenges, bringing them back to the building, significant learning challenges, bringing them back to the building a little bit earlier in small groups. And again, those are broad concepts with further details that would be within each concept. And time will tell, as each week goes by, as the COVID-19 data is shared with us, we'll continue to work with public health and city leadership on any kind of decisions that we'll make as a school district. And just as a reminder, we're still in phase one of Governor Burgum's Smart Restart concept. And we would be planning for phase two, which includes some, but not all of the concepts for how we would get back to the building. Basically, some of the concepts that I've already shared, so I won't share our Smart Restart bullet talking points with you. I think probably the biggest item that's weighing on everybody's minds would be graduation. And so I'll give you the very skinny overview of what that will look like. First of all, on May 28th, Community High School will have an evening graduation scheduled for their parking lot outside of Community High School. Principal Terry Bohan is putting detail to that. And for each one of these ceremonies, because it is non-traditional, we want to make it very memorable. Also, Central High School and Red River, we're scheduling those graduations on the dates that were already on the calendar. Central at 12 noon on May 31st, Red River at 4 p.m. on May 31st. These will be outdoor graduations outside of the high schools, and they'll be organized in, when I say car fashion, when I say drive-in, I don't want anybody to think it's a parade where students are driving by and they extend their hands out the window and they pick up their diploma. That's not the concept at all. We will have to organize people in a very social distance manner and respect that this is going to take a little bit more time than probably what our traditional high school graduations require. But I think what's important for the public to know, what's important for students and parents to know, that was decided at our school board meeting on Monday night when high school principals presented this model is there will be a stage. Students will have caps and gowns. They will cross the stage. They will receive their diploma. All of this will be live streamed by HB Sound and Light. We're also planning on a live broadcast using radio, almost to a play-by-play color commentary type of production. And then when all is said and done, because the speakers won't speak live, and when I'm talking about speakers, I'm talking about students, they will be pre-recorded. And once the whole event is done, then we will package this in a memorable video concept for students and for parents. So that's what graduation is going to look like. What's the backup plan if we have tough weather? We're going to be close enough to our gyms where we can move inside, and it will be very intimate if we have to move inside. So stay tuned for more details on that. But as our principals have said all along, I think somebody owes us a little bit of a break, and we're planning on good weather on May 28th and May 31st. And that's what I have for you today. Thank you, Mayor Brown.
Thank you, Dr. Brenner. Now we'll hear from Mr. Jeff Gockler, Mental Health Coordinator. Welcome, Jeff.
Thanks, Mayor Brown. Privileged to be here today and just talk about the importance of mental health. There's so many important topics these days. Obviously, physical health and city infrastructure and government and education. And I think as I pivot into talking about mental health, I'll highlight a recent North Dakota statewide survey where the data was just compiled, and there were over 11,000 responses from fellow North Dakotans. And the top concern that was noted was increased mental health struggles. And over 2 out of every 3 people that responded to that survey talked about not only their own mental health struggles, but those of family members in the home or others in the community that they were seeking to assist. And over half of the respondents talked about how the social distancing has an impact on the mental health of, again, not only themselves, but those in their home. And so how do we combat that? We know we have to stay, physically distant, socially distant, but how do we stay connected? How do we still support one another? So in other words, what can we do? And it's actually a group, Mental Health America, that started the Mental Health Awareness Month for the month of May over 50 years ago. And there's a lot of different groups around the country, not just locally, that put their own stamp on Mental Health Awareness Month. In fact, I was just learning today an interesting partnership between Google and the CDC of all groups. And their mental health awareness initiative is simply called Be Kind to Your Mind. And it comes with 5 simple steps. And I think it's worth repeating here. Step 1, we all need to just stop, pause, take a breath, and most importantly, notice how we're feeling. And I'm going to circle back to that one and talk more in depth about that. Number 2, as important as it is to stay informed and updated on everything related to COVID-19, I think the importance of not having COVID-19 run in a person's home 24/7 and knowing when to take a break from that content is important. Give our minds a mental break from just everything that goes along with kind of our new normal. Step 3, make time for sleep and exercise. I think that can't be overstated. Make sure we're getting our rest, make sure we're getting our physical activity. That helps our mental capacity. Step 4, and I've talked about this before, the importance of reaching out, staying connected. And then last, step 5, seeking help if you or someone is feeling overwhelmed or unsafe. And so I want to circle back to that part about owning our feelings. I think it's not just in North Dakota, but I think especially in North Dakota, I know I've heard about, I've heard Governor Burgum talk about how we pride ourselves in being strong in North Dakota. And I think sometimes we try and just muscle through and tough things out. And with that sometimes comes the mindset or the philosophy that I'm just going to bottle things up and march forward, march through this. And from a mental health perspective, that's not always the most healthy thing we can do for ourselves. And so, the research shows that people that are good about not only recognizing their feelings, but talking about them, discussing their feelings, not only are they going to be mentally healthy, they're less likely to binge drink, they're less likely to be physically aggressive, they're less likely to self-injure. So how do we do that? For those of you that are concerned about yourself or a family member or a loved one, encourage them to do something simple. It's as simple as a mental health screening. So, like, for example, on our school district website, we have the mental health hub at the top of not only our district website banner, but each individual school. And one of the first links on that mental health hub is simply a mental health screening, and it's tied into AllTrue. And they're confidential, they're free, they're anonymous, and they can get a person connected to help. Simply put, think of it as a checkup from the neck up. And it's, get informed, get screened, and get help if you need it. And then lastly, I guess I would talk about a group that I've been communicating with here earlier this week. There's a number of us here in Grand Forks that are trained in a national program, both mental health first aid and youth mental health first aid. And the goal, historically, that's an 8-hour class that we open up to the general public. And needless to say, we've had to cancel a number of those offerings here in the community due to the COVID-19 response. The national organization has recognized the importance of teaching recovery, teaching resiliency skills, now more important than ever. And so they've created a virtual model that they have not offered before. And we're going to be able to be trained in that hopefully as early as this June. And once we receive that training, we're going to open those courses up to the community. We'll put that information on our GF Cares website. And it's simple things. We would want to make this as common as CPR training that so many of us received over the course of our lifetime. Our goal isn't to turn anyone into a junior psychologist or counselor, but how do we teach each of us in our community to be able to do a simple assessment for suicide or self-harm? How do we help people understand the importance of listening non-judgmentally? How do we help people to know when to give reassurance as opposed to advice? How do we encourage people to seek professional help? And then also lastly, the importance of self-help and other support strategies. So, as simple as creating a mental health care kit for yourself, I would encourage people to look online and create a little DIY mental health care kit. I know that's something I've been researching and looking at putting together a project, and how do we distribute mental health care kits to those that could use a little pick-me-up during this time. So again, lots of different websites, lots of different hotlines and helplines, the gfcares.com, the Mental Health Hub, the Mental Health America with the Mental Health Awareness Month is mhanational.org. So would encourage people to just reach out and seek help.
Thank you very much, Jeff. Now we'll go to Pete Haga for a question and answer portion of our program. And we also have on the panel Todd Phelan and Director Swanson to answer any questions. Mr. Haga.
Thank you, Mayor. And we had the first hand up with KNOX. KNOX?
Yeah, I have a question for Dr. Brenner. Dr. Brenner, can you tell us what you have in mind as far as a time frame for alerting parents to what school will look like in the fall? Because with all of those circumstances that you put forward, obviously there are adjustments that parents have to make about having their kids in school with each one of those scenarios. Is there a timeline someplace where you come to parents and say, this is what the fall looks like?
Well, again, if we had a crystal ball, it'd be nice to say by June 15th, we'll know what we're doing on August 26th. I just don't think that's the reality. We're just going to have to continue to monitor what our community looks like, what our present environment looks like. But certainly we want to give parents ample time to plan because we know this has been a challenging time. It's been a hardship on parents with work schedules, having kids at home, having multiple kids at home, trying to be a teacher. So, the short answer to your question is, as soon as we have all of the right information, make those decisions, we will make those decisions. But thank you for the question.
Okay, now we'll go to Joe Bowen. Joe?
Hey there. So my understanding is that it'll take about a week or two after the beginning of the Smart Restart for coronavirus cases to start ramping up or to not ramp up or whatever. Assuming that's the case, and tell me if it's not, I won't take it personal. What do people here expect to happen kind of going forward? This is the end of the second week of the Smart Restart.
Hi, Joe. This is Debbie Swanson. I think there's an assumption that we will see an immediate increase just because we are changing our habits, and that's not necessarily true. What we know is this virus is very tricky. It will find ways to find a host, which is humans. And if people travel or move to other areas and then come back to the community, or if people are infected at different points in time, it can spread sometimes asymptomatically, and we may not see an immediate increase. So it's not like we turn a switch, we go back to some of our usual activities, and then we see an increase in cases. It might emerge over time. And in fact, that's what we're seeing in some other countries that previously had very few cases, and now they're seeing some resurgence. And it's really based on a lot of things that we don't know about this virus yet. So it's not a really safe assumption to say that we will immediately have cases in 1 to 2 weeks.
Okay, thank you. And I think we'll go to Neil Carlson.
I guess my question is both for Mayor Gander and Debbie. Has Meridian Behavioral Health or the State Health Department reached out to either of you regarding COVID cases at the Douglas Place Treatment Center and what they're doing about it?
Mayor Gander?
Question, and I appreciate that. So I can tell you that on our side of it locally, I think that it was pretty well covered in the Grand Forks Herald as far as timelines of what's gone on, and those are accurate timelines. Several weeks ago, I received a call that was grabbed by my voicemail at City Hall, which I retrieved the day that it came, and it was from an employee there who had a concern about what was going on and had some detail in there that was about, of course, COVID and some cases that were starting, and also making sure that their practices were up to speed in terms of the CDC requirements for not transmitting the disease. Well, that same day, as was indicated, I did reach out to our county health person, and she reached out right away to the state health department. It all took just a matter of 5 or 6 hours on a Friday. And by then the Minnesota Department of Health was involved. Now they were reaching back out to the Douglas Place and communicating with them about what are the steps that are required by the CDC inside of that facility, and back and forth, and getting the assurance about what was going on there. And the indication that we received back through county health, through the Minnesota Department of Health, the following Tuesday was that they had confirmed that they were in fact following the standard protocols for the control and containment of the COVID coronavirus, the COVID-19 spread. And so that's what indication we've gotten. And then there have been bits of information that have come from there also indicating good compliance, good cooperation, good transparency back to the Minnesota Department of Health. And so all over and over again over the last several weeks, that's the indication that we've gotten, is that the state is handling it and that it's running right through the county health department and back, just informing me of what's going on.
And Debbie, did you want to, anything else?
I think Mayor Gander covered it pretty well. I don't have anything else to add.
Okay, thank you. Next question, Dave Kolpak.
Hi, I have a question or two questions for Debbie. Debbie, do you know about how many tests you were able to administer today? And my other question is, all eyes have kind of been on Fargo and Cass County now with their high number of cases. And as someone who's kind of in the middle of the initial hotspot that we had in North Dakota, do you have any advice for the people of Fargo and Cass County trying to figure things out here and working on this task force?
Well, I have an update on the number of tests that were completed today as part of our testing event, and it's 475. So if I seem distracted or I was off camera, it's because I'm getting some updates from people that are working at the testing event, and we have a few supplies to leave in the community for those that can continue to test in healthcare institutions. With respect to Cass County, not having a lot of information about exactly what their contact tracing is finding, I don't want to make any assumptions about what is happening there. Certainly, we had a different situation where we did have a workplace that was significantly impacted, and we worked really hard to do contact tracing around that and isolating and quarantining individuals, and we continue to do that.
Sorry about that.
Is that better?
That's better. Sorry about that.
And I know that Cass County is also doing the same, that they are continuing to do contact investigations with every case that they receive. I know they're providing a tremendous amount of support and information throughout the community. They are a larger community. We do see that there tend to be more cases in highly populated, more densely populated areas of our nation. So I'm certainly sympathetic to the situation, but we are one state and one valley, and we have to help each other out whenever we can.
Thank you very much. And sorry for the difficulties. I think we've got that straightened out. The next one, Chris Larson.
Thank you. My question is for Mayor Gander. Mayor, last night, Governor Walz was asked about a plan for greater Minnesota and then a plan for outer Minnesota. And he kind of, in reference to a one size fits all. What's your thoughts on that type of plan? You think that would work in Minnesota, or do you think the plan that's going right now is sufficient?
So it looks like I'm here to answer that. That is another really good question. I'd always hoped that you could some way customize a response to COVID in terms of each state, each county, and then even each subdivision. And we're doing it somewhat, I'd say very, very well for essential services. You're stratifying it according to essential services. But to be able to customize it inside of a state, which has, as you say, such a different character in the metro versus in the outstate area. Now, in the same way that it's a challenge for us with North Dakota and Grand Forks coming in with a more, let's let the people do what they believe is right. And on the Minnesota side, a more of a stringent standard, more of a constraining us a little bit more. And that border being different has created some challenges. Well, in the same way, in empathy with Governor Walz, if he tried to customize it per county, you'd have adjacent counties saying, wait a minute, I can go to the restaurant here, but I can't go to the restaurant there. And so he's tried to frame it as a one Minnesota strategy. And while even though intuitively I'd much rather see it customized by county, I think from a practical standpoint and from a real good cohesiveness of the state standpoint, I understand what he's doing. And again, I respect him. He's done a really good job, particularly now that he's relaxing things and letting us get about our business. So I see the as much as I like the idea of it, I see how very hard it would be to implement and would create a lot of discord between adjacent counties.
All right, thank you. Now we will go to Matt Henson. Matt.
This is for Mayor Gander. Just to kind of follow up on Douglas Place there. You said, the appropriate protocols and steps are being followed. What are they? We received a lot of calls from the public and employees there. What are those protocols and procedures that are in place to ensure that people coming and going from the building, especially clients, aren't then passing COVID throughout the East Grand Forks community?
Very good. It's all the same precautions that all of us are taking. It is the mask, it is the social distancing, it is the frequent hand washing, it is the cleaning of frequently touched areas. From the staff standpoint, it is mask, it is eye protection, it is gloves, it is hand sterilization on a frequent basis. Again, into commonly shared areas, closing off common areas completely, avoiding group gatherings of any size, and meals being eaten more in the rooms. So it's all the stuff that we know. It's all the stuff that would carry over to other kinds of congregate living facilities. And those are the kinds of things that the Minnesota Department of Health are keying into to make sure those are being followed for the protection of all three subgroups, the staff, the residents, and the greater community, because as has been indicated, this population of folks is free to come and go in the facility and out. And so now you're out potentially impacting the community. And so it's all of the things that you know of already applied to a little higher standard inside of what would be considered a care or healthcare facility.
Thank you, Mayor. I think we'll go to KNOX, please.
Mayor Gander. Mayor Gander, you mentioned the adjacent counties. Let's talk about adjacent states. North Dakota's open, South Dakota's open, Iowa's open, Wisconsin's open now, Minnesota's not open. You mentioned that you feel like Governor Walz has done a good job, but people in East Grand Forks can't go to a restaurant. People in Grand Forks can. Do you feel like there's support for Governor Walz's approach to this in East Grand Forks?
You know, I've decided, and back to our previous presenter about mental health, and I've been through enough challenges in my life to know that it doesn't pay to get crabby. It doesn't pay to get hostile. It doesn't pay to get even words like vindictive. The better way is to just say, okay, what's the reality? What's the situation? How do we optimize the outcome inside of that reality? And I do think, you know, if I take a look at Governor Walz, I take a look at the particular affiliation that he has, the little bit of a bias that we all have. Everyone has a bias. Given his bias, given the folks who are advising him and recommending various courses of action to him, and then even the accountability brought in by the legislature. You know, there's been some pushback from the legislature and also from the citizens about, hey, let's get back to life here. And so honestly, if I'm stepping into his shoes, into his world, into, you know, the miles that he's walked up to this moment, do I feel 1 ounce of duplicity coming out of him? Does he have some hidden agenda or some, you know, weird motive behind it? I say no. I honestly believe in his heart of hearts, he's absolutely doing what he thinks is right for the people, protecting them and giving back that freedom when he thinks it's right. And now if I'm talking to an individual business owner in East Grand Forks, unable to serve in the restaurant, am I a little unhappy about that? Yes. Do I wish that there was a little bit more parity with our friends on both sides of the river? Absolutely, yes. And yet we're all the way back around to, you know, same with even as in my day job, we had to hold off a little bit longer on opening our clinic at 50% to see patients, but it doesn't do any good to cry over spilled milk. You took that time, make some additional preparations, get some more PPE to take care of folks when you can open up, make sure your systems are locked down tight as a drum. In the case of restaurants, just go full bore on the curbside. And when it opens, it's going to be good. I mean, that's all I can say.
Thank you. We'll take a community question at this point, probably for Mayor or Debbie. What is the plan in Grand Forks if we see a surge in cases?
Well, then we'd have to go back to an earlier part of the Grand Forks Restart SMART plans, which would go backwards to limiting people maybe to curbside, takeout, delivery versus having dine-in. And we would have to minimize interaction within close contact businesses. So we would monitor it ongoing and then see how we needed to respond.
Thank you. And we'll go next to Mr. Chris Larson. Chris?
Yeah, my question is for Jeff. Jeff, you know, there's a lot of talk about nursing homes right now and people not being able to see their loved ones, whether it be, you know, loved ones that healthy, have COVID, or ones that are, entering that last phase. As somebody that deals with mental health, what are some of the tips, or what's some of the guidance you would give people that are dealing with this?
That's a great question, and it's a sad reality for a lot of people throughout our world right now. And I can speak from a personal level too. I've got a daughter who works in a senior living facility. My father recently has been hospitalized, and family not been able to go see him. So had members of my family tested, and I think each of us goes through that experience, wondering and fearing kind of, am I going to be able to see this person one more time? And kind of like Mayor Gander said, we have to deal with the reality of the situation in front of us. And, I heard a sad but heartwarming story recently, and it was an older gentleman who had been hospitalized, with COVID-19, and his 3 adult children stayed on the line with him for, I believe it was the last 48 hours of his life. And they took turns for 48 hours straight, or whatever that exact number was. They talked to their father, and he wasn't really able to communicate back. But again, they took a terribly unfortunate, sad, tragic situation, and they did the best they could with the reality of that. And I think a lot of times with mental health concerns, the people I work with, I talk about what's in your control and what's not in your control. And I know when my father was hospitalized, and I talked to my mom on the phone, and she said they wouldn't allow me in the hospital. We made the best of that situation. And again, finding your supports, and reaching out to the people you can, and finding a way to communicate. If there's a way to have communication with someone, it's in a nursing home facility or a hospital setting, if the staff there is able to arrange that for family members and loved ones, certainly that would be an important from both sides of that fence, both the person that's going through that as well as the family members and loved ones.
Right. Thank you very much, Mr. Gockler. It looks like we have time for one more question. I did see a hand raised from Mr. Joe Bowen. Joe?
Yeah, hey, thanks. So presently, how many people associated with LM Wind Power, like an employee, close contact, whatever, have tested positive for COVID-19? And then real quick beyond that, the Wind Power employee who died recently, is their death related to COVID-19 or caused by it? And are they that Polk County fatality that was announced the other day?
I'm looking to maybe Deb on this one. Debbie Swanson?
The last number that I had for positive test results at LM Wind Power was 145. I don't know if additional tests have been positive, because they may not have been reported associated with the place of employment, or they might have been a Minnesota case that we might not have known about. I can't speak to any recent deaths. I don't have any knowledge of that. I'm sorry.
Okay, thank you very much. And I think want to thank everybody for attending today. As we always do, we will end with Mayor Brown. Mayor Brown?
Thank you. I want to again extend my thanks to Dr. Steve Gander, Dr. Terry Brenner, Jeff Gockler, and Director Swanson for your participation today. So remember to keep up the physical distancing measures and follow the CDC guidelines. Wear a face covering in public settings, disinfect frequently used surfaces, and practice good hygiene. Exercise your mind as well as your body in ways that are safe for you and your neighbors. Make sure to continue to support local businesses through takeout, delivery, curbside pickup, or on-site service. Stay vigilant, stay cautious, slow the spread, and save lives. We're in this together, we'll get through this together, and together we'll emerge stronger. Thank you.
And thank you very much. That concludes the conference.